Hey everybody, Liz Lacy here with a Schema Therapy hack for treating addictive disorders. So I'm going to give you a little nugget on what you're looking at when you are working with people who have either little bitty addictive disorders or big ones. And if you're doing this work, which I imagine you are, you will have by this point had a few things cross your mind while working with people with addictive disorders. And one of those things is, what is going on? It's definitely a feeling that you will have either early on or later on in treatment because of these modes that shift in and out. You've got somebody there that's really ready and willing and motivated, and you're talking to, and they're feeling their guilt, and they're feeling like they want their life back. And you see them 2 sessions later, you get a different person. All of a sudden, it's like, nah, I got this now. Or, it's hopeless. I went back to it. There's no point in trying, right? All these things that we get in treatment that seemingly just derail us, right? So we start to feel hopeless. And I know many, even schema therapists who have somewhat given up on treating addictive disorders. But I think this is going to really help you. So I want you to think about what I'm about to tell you as there's this wall, right? There's this surrender or avoidance wall around the addictive cycle, right? So the 2 modes that pop up as a way to protect the addictive cycle is this wall, okay? And both of these modes are enabling modes. And when I say enabling, I mean they enable the addictive cycle to continue in one way or another. And remember, people have chosen these addictions for really good reasons, even if the result has been terrible and really damaging to them, to their families, to communities. But they do it for good reason. As you will find out in the training, should you decide to go ahead and take that. So the 2 enabling modes, like I said, are avoidant modes and compliance surrenderer modes. They can be helpless surrender, hopeless surrender, and what kind of looks like an addicted person as sort of a detached surrender. In other words, there's not as much pseudo vulnerability that comes with it. It's sort of just like this is just how it is for me. This is just what I am, right? It looks like acceptance, right? But it's really a surrender mode. So the core issues here, right, is they protect, like I said, this triple mode cycle. They maintain the addiction. Interestingly enough, both the avoidant and the compliance surrenderer helps to disconnect from the inner critic, because if I'm helpless and there's nothing I can do about it, I can't be held accountable, and it doesn't trigger my inner critic as much. And particularly the avoidance is fantastic at disconnecting from the inner critic. And both can maintain this double life. So when you're feeling like, what just happened? What mode am I dealing with now? We made progress and now it looks like we've taken 10 steps back. I want you to think these enabling modes, right? One of these 2 are probably at play. So see if you can really identify this and help the patient to identify this. Okay? So as you're identifying this with the patient, right, what we're going to be going toward is an empathic confrontation of these enabling modes, so we can get back to the work of working with the addictive cycle. So you're going to end up going in and out of a lot of empathic confrontation. If you're not comfortable with empathic confrontation, don't work with people who have addictions, okay? So just as a little reminder, we have empathy for the why, and we have confrontation for the how. So why they're using the particular behavior or mode, but the way in which they're going about it ends up becoming destructive. And what you want to do is label it, help the patient really feel and recognize the modes, and use chair work to do this. Yeah, you could do it in imagery, and you could do it in chair work like a mode dialogue, right? Just two chairs, really, which would be a mode dialogue. You could play one, they could play the other half, but it is most effective when they are playing both halves. The part that says surrender, let them really hear it, and not just hear it. As they're expressing what it feels like, what it's telling them, have them feel it in their body. Right? The same thing with the avoidance, the minimization, trying to sweep it under the rug, all of those things, distraction with a new crisis. That's a popular one. Help them feel it in their bodies, because oftentimes that's the thing they'll recognize first when they're not with you. They'll feel that feeling of just that surrender mode, that sinking feeling in the chest. Oh, wait a minute. I know what this is, right? It's the surrender mode. And of course, surrender modes are all or nothing thinking, and like other modes, very, very rigid, right? They're not real vulnerability, and they're certainly not healthy adult modes. So this is what to look for when you get stuck. And this is going to be really, really a skill you're going to want to if not master, practice a lot. And I hope you will check out Schema Therapy for the treatment of addiction, where I go into many, many details and lots of good demonstrations. So hope this helps somebody. Ciao.